When buying in cattle for restocking or trade, it is important to ensure that they are healthy and will be productive going forward, and that you don't bring anything unwanted onto your farm, such as resistant worms. When new cattle arrive on farm, it is important to consider health, welfare and biosecurity. Firstly, you should have a biosecurity plan in place on farm and follow this. It's also essential that newly arrived cattle have access to water and feed soon after arrival. When considering health treatments, there are a number of conditions to address to make sure the animals remain healthy, are productive and don't bring in unwanted travellers. Drench resistance is present in cattle worms in many regions of Australia and is increasing, so it's vital that this is managed when introducing cattle on farm. The best way to do this is by giving a highly effective quarantine drench to all cattle when they arrive, even if they've been recently drenched on the farm of origin. This is achieved by using a short-acting oral drench that contains as many actives as possible. The only drench that fits all of these criteria is Cooper's trifecta. Studies have shown that oral drenches perform better than pour-ons or injectables, and it's postulated that this is because a higher concentration of active reaches the target worms. A key study looked at all three application methods when moxidectin was applied and found oral administration, on average, was 91% effective, while injectable was only about 56% effective and pour-on was only 51% effective. This study included 14 farms, of which there was some level of resistance on most of these farms. Vaccination against Clostridial diseases, especially pulpy kidney, should also be a high priority at induction. Clostridial diseases cause significant losses, and it's essential to know that the cattle are properly protected. I've always advised that when cattle arrive on farm, they're vaccinated. Vaccinating cattle yourself is the only way to be certain they are properly protected. Cattle should be vaccinated on arrival and then again 4 to 6 weeks later with either a 5-in-1, 7-in-1 or 8-in-1 vaccine. There are many options available, but if pulpy kidney is a risk, then you should consider Tasvax 5-in-1 or Tasvax 8-in-1, which after 2 shots provides 12 months protection against pulpy kidney without the need for seasonal boosters every 3 months. Bovine respiratory disease, or BRD, is certainly a concern at induction, particularly in the case of young cattle, as BRD can lead to poor growth rates and even deaths. BRD can be caused by a number of different bacteria and viruses and tends to occur when young cattle undergo stress, such as when they're transported, mixed with other mobs, there's changes in diet or changes in environment. A bacteria, Mannheimia hemolytica, or MH, and a herpes virus, known as IBR, are considered the 2 most damaging contributors. The simplest vaccine protocol to provide immunity against both MH and IBR is to use Bovilus MH plus IBR. This is a ready-to-use combination vaccine that requires 2 shots for maximum immunity, which can be given 2 weeks to 180 days apart. To achieve the highest level of protection after arrival, it is recommended to give the first vaccination on arrival and the second vaccination 2 to 4 weeks later. This can work in nicely with the Clostridial vaccine protocols we talked about earlier. Whilst it is best to cover as many factors as possible, some producers may choose just to vaccinate against the bacteria, MH, and not the viral component. There are 2 vaccines available on the market for this vaccination. Given that the cattle have just arrived on transport and are under stress, some animals may not mount a sufficient immune response after a single dose of vaccine. So it's advisable to use a 2-shot program to ensure that all the animals have good immunity against MH. Bovilus MH vaccine is a ready-to-use vaccine which is ideal for this, and the 2 shots are given 3 to 4 weeks apart, which again can fit in nicely with the Clostridial vaccination program. Depending on the season the cattle are arriving in, you may need to consider a lice treatment or perhaps a fly treatment or pink eye vaccination. In northern areas, ticks and buffalo fly need to be considered as well. We've covered in more detail the 3 most significant health issues that can arise with new cattle, but it's also important to follow your biosecurity plan. and seek advice from your vet or advisor for things that might be specific to your situation. If you'd like to know more about effectively inducting cattle, get in contact with your local Coopers representative on 1800 226 511 or visit the Coopers Animal Health website.